Hi, I'm Ed Dunn. I'm a physician with palliative medicine, palliative care at the University of Louisville and U of L Health. My story goes back a long time. When I was observing my younger brother, who was quite ill back in the days when pediatricians still made house calls. And he stayed with my brother all night, who had dangerous fever and was very, very sick, and got him through that night. And I thought, well, this is really meaningful, and I think maybe this is what I want to do. And then my high school football coach taught biology, and I got very interested in that subject because of our relationship, because I played for him. And got more and more interested in healthcare as a career. I'm a palliative medicine physician. I do palliative care. I've been doing it for about 8 years. Formerly, I was a cardiovascular and thoracic surgeon for 20 plus years. And what we do is have a presence with people who have life-limiting disease. What do I mean by that? We listen to them. We talk with them. We attempt to develop a relationship with them so that we can support them and their families who are going through very difficult times. And we provide symptom management, meaning relief of pain or shortness of breath, for example. We provide support, social support, in terms of resources and social needs, psychological support, mainly by just listening, but also counseling. And then finally, spiritual support. And what do I mean by spiritual support? Really, it's about meaning. Life's meaning. It probably goes back to Hippocrates. Develop a relationship with your patient so that they're entrusting their lives to you, and so you have to spend time with them. You can't put a stopwatch on their relationship. You can't establish time frames that are not authentic. And what we do is spend a lot of time supporting patients and families. And so it's very time consuming, and to have a presence, an authentic presence with the patient, you really have to listen to them, and we spend a lot of time listening. I began to help patients who had cancer, who were suffering from cancer pain, who also had substance use disorder, heroin, methamphetamine, any of those illegal drugs. And realized that these people were really lived in the margins of society. They didn't have primary care doctors. They weren't really in health systems. They went to emergency rooms for care. And so I got a waiver to use buprenorphine, Suboxone, to help people who had cancer pain, but also had substance use disorder. So it's a much safer drug, but it's a very effective analgesic. I was an inveterate runner. I ran for about 35 years, long distance running, until I ran myself out of my left hip and I had to have a left hip replaced. And so since then I've been walking my dog for long walks. I have a golden doodle puppy. She's now a year old. I have 9 grandsons spread between Chattanooga and Washington, D.C. I spend as much time as I can with them. They're a very important part of my life. I swim, I bike, I read, and I'm joining U of L because I really love, and I've always enjoyed, time working with students, residents, fellows, and fellow faculty members.